million. The biggest risk we're going to have that we've got to watch is our spending at the Department of Health and Hospitals. The DHH has said pretty clearly, I think, during the legislative session, and I believe they say the same thing now, that the amount appropriated to them is going to be short about $338 million from the money they're going to need. DHH says they need another $237 million for Bayou Health, another $60 million for community-based waivers, another $16 million for Medicaid prescription drug payments for our dual eligibles, and another $9.1 million from long-term personal care services. And there's one more I can't remember. So that's $338 million.
A moment ago about DHH spending, and when you were here last time, you talked about 900,000 in 1 year visits to the emergency room for non-emergency care. Could you care to elaborate as to why that seems to garner so little attention to put a spotlight on those facts versus the inherent proclivity to say, let's raise more money, let's raise more money? Could you just comment on why you think some of the points you're making don't seem to be getting a whole lot of attention?
Well, controlling costs while still being able to deliver a decent product is hard work. I mean, it's not as easy as just walking in and raising taxes and fees. It's hard work.
Mm-hmm.
The governor's not here. He's good, but he's not that good to be able to do it when he's in another state. It's hard work. I just watched what other states have done and done successfully, and it's clear to me that those states that are doing something to control their costs of the Medicaid program are doing it in part through controlling the abuse of the emergency room. It doesn't mean these folks are going to go without care, but you can give a pregnancy test a lot cheaper in a private clinic than you can in an ER. You know, I probably told you all this last time, but I don't remember his name, but I got a call one time from an emergency room physician in New Orleans. He read something earlier. He said, "Kennedy, you're right." He said, stop me if I told you this before, but he said, you know, we've got a lady, an elderly lady, sweet as she can be. She comes to our emergency room every Saturday night. And I said, well, why? She gets sick every Saturday? He said, no. She lives with her kids. Her kids don't want to pay for a babysitter. So they drop her here every Saturday night. And we got to give her a physical and talk to her. We have a good time. And then I send the bill to Medicaid for a couple $1,000, and they pay it. Now, how much sense does that make? And you know what DHH is doing about it? Nothing. That's just my opinion.
Thank you, Treasurer.
Yeah, Mike.